in the high. 23 and a half minutes to 8.
And you're with Morning Reporter. Northland DHB has been asking schools to consider excluding children who have not been vaccinated for measles. For more on this and the issues with the Waikato DHB, I'm joined by the Health Minister David Clark. Morning to you.
Good morning, Corin.
How concerned are you that in an area like Northland, where we know the immunisation rate is poor at 85%, so that means that measles is a real risk, that we've got a school with 200 children not immunised?
I am deeply concerned to see vaccination rates have slipped. It's not something that's happened overnight, but we know that the best protection against these kinds of diseases is vaccination. In fact, the science is very clear on this, and those who don't get vaccinated put other vulnerable people at risk, not just themselves.
They put them at risk, so should they be kept from school?
Well, there are, my understanding, and I'm going to receive further advice on this today, there are powers that the CMO can invoke with the schools, and in the case of a big outbreak, people can be excluded from schools.
We don't want to get to that point, though, do we?
It's exactly right.
And that's what the DHB is trying to say here. It's encouraging principals to encourage parents to keep their children at home if they are unimmunised. That's 200 children at one school who are going to be told to stay home.
That's right. Well, I think the first and foremost, the most important thing is that the DHB needs to get on with addressing the low immunisation rates, and that is something that is the DHB's responsibility. They are the one charged with ensuring that we have immunisation rates up in the
So you think
community.
they haven't been doing their job?
I think they need to do better, and I will certainly be speaking to the Chair about this matter to hear what plans they have in place to address the lower immunisation rates. There's no doubt that there is an issue with the anti-vaxxers, and so I'm not denying that.
Sure.
But what I would say is that this is something we're taking incredibly seriously. The Ministry of Health has written to all DHB chief executives in recent weeks, asking them to tell them what they're doing, what's in place, what they're going to do to get the vaccination rates up. And it is the job of the DHB to work with providers, to work with the communities to get those rates up.
But they are fighting anti-vaxxers. We heard this morning from Dr. Chamberlain about movies, about Northland being targeted. So it's pretty hard for the DHB to be fighting that. Are they supposed to go out on social media and try and fight the fight there?
Well, I think they'll use whatever methods they have at their disposal.
So they should?
They should use what methods are at their disposal. They've got to encourage their communities to understand the benefits of this and the dangers of not being vaccinated. Let's not forget measles is incredibly infectious. If you walk within 2 metres of somebody with measles, if you're unimmunised, you're probably going to get it.
But you could set the example by giving them or by giving them a signal that it's okay for them to literally ban kids from going to school if they are unimmunised. That could be done, couldn't it?
Well, I imagine that if you go down that track, what happens is that those kids that are excluded from schools are probably those that need the education and science the most. And I'm not sure that that's where we want to go as a society. What has worked in the past is where DHBs have run community clinics, run them on marae, actually got out into the community and made sure that they're connecting with the people directly and helping people to get immunised. Sometimes it's just people who haven't got round to it or don't understand the importance of it. It's not always these hard-line
Those ones are the easy ones.
And those are the ones that we need to reach.
Yeah, but if you've got the anti-vaxxers, at what point do you get to the point where you say, well, I'm sorry, but your particular view is overridden by public safety and the risk that this disease, we know it's extremely contagious, spreads through like wildfire through a school, and then vulnerable people get exposed?
Well, I'm not convinced we're at that point yet. Around the country, there are variable take-up rates, and it does depend on how active, to some degree, how active the DHB is in promoting the vaccines and making sure that their population is covered. And there's different things that work. I mean, one of the other things, earlier this year, there was a program targeting young mothers, 18 to 39, and it was incredibly successful, run by the HPA, an advertising campaign, and making sure those messages are going to the right people. There's a World Vaccination Week where the profile's been raised again this year. This year, a number of things have kicked off, and I think partly triggered by the fact that there was a community outbreak declared in Northland for meningococcal.
What about some other measures? I mean, I see in Australia they have powers to send children home. Could you consider that?
These are things that I would need to talk about with the Minister of Education, but my view is if you punish children for the decisions of their parents, you end up entrenching a problem rather than actually getting to solve it.
What about fines? Because Italy's implemented a fine system, haven't they?
Again, you're going to punish. Well, you can focus that on parents. My concern
But
is
it's sending a message
that
because the message isn't getting through. And you said yourself that you're not that the DHB is struggling to get its message across.
The DHBs need to be more proactive. It's the reason why the ministry
Tell me
wrote
how that would work.
to,
What does proactive mean?
So that means actually getting out in the community, doing those community clinics. It means reaching out to community leaders, working with other groups in the community, the providers, the GPs, and so on. And this has been done in the past. It has been done in different DHBs in a way that's more effective in some than others.
There's an opportunity
we need
cost
to learn
there, though.
here.
And that was a point that actually Dr. Chamberlain made to me this morning. There's an opportunity cost, so resources have to be diverted. So are they going to get extra resources to do that, particularly Northland, which has got an acute problem, or a more acute problem?
Different local DHBs make decisions for their local communities. It's their responsibility to prioritise with the resources they have, and this is something that I've been highlighting as a significant issue across DHBs. It's something the ministry has written to all chief executives about, and it is the responsibility of the DHBs to serve their local communities and look at what the needs are in their community and to get on with addressing the issues. And they need to have a plan in place as to how they are going to raise immunisation rates.
You've got a message there to the DHBs. Of course, this is in light of the Waikato situation where you've put in a commissioner. This is a pretty serious move. It's only happened a couple of times in New Zealand's history. Why was this warranted?
Well, I had serious concerns about the stability and strength of the governance at the DHB. I wrote expressing serious concern and received submissions. I considered those, and it is my view that in order for the DHB to provide the strength of governance required into the future, that we actually need to put a commissioner in place.
There obviously is a big deficit, and that is a key part of it. Can you give the people of Waikato an assurance that having a commissioner is not going to mean cuts in their services?
That's an assurance I can give them. If let me be clear though, methods of care change, so things are done differently.
So no cuts in services.
DHBs prioritise different things at different times, so I can't give you
Sure,
an absolute guarantee on that. I expect the overall services to be better provided and to be more of them over time.
So how do you turn the deficit around then?
The deficit gets turned around by investing in different models of care. That sometimes costs money up front to start with, actually, but over time can produce significant savings. And that's what other DHBs are doing. And as Minister, I have tolerated deficits with some DHBs where I can see they've got a plan in place to actually get them back to sustainability.
How quickly can we expect to see the Waikato DHB showing at least a pathway back to, I won't say surplus, but somewhere near it?
Well, I would expect, within a year to see a plan to get back there. It's going to take a while to deal with wrestle with the details. They've got challenges that involve looking at how the different hospitals in their district work together, working with the PHO. They've got a number of different challenges, and Karen Patasi now has the challenge of getting in there, mapping out the plan, and showing how we're going to get back to sustainability.
Okay. Are there just simply too many DHBs in New Zealand? We're spreading the talent too far. It's not working. We need to shrink the number.
I've always had a view that there's greater opportunity for shared services amongst the DHBs that are there, which tends to suggest probably the answer to your question is yes, or at least in a sense, a lot of that's already happening. We've got a health and disability review underway, which Heather Simpson is leading. That report's back with an interim report in August,
I was
and
going to ask
finally
that,
in March next year.
Because you made these sort of similar comments a year ago, so we're well into your first term as government. If you kind of knew a year or so ago that maybe the system's not as good as it could be, when are we going to start seeing some action on making some changes?
Well, this is a thorough review. It's not a political once over lightly, Corin, because I think we've got to be careful about babies in bathwater here. When I look around the world and compare our health system to others, we've got extremely dedicated professionals that work in it. We have quality healthcare, and we provide it cheaper than just about anybody else we like to compare ourselves to. So our system works. But there's not one person I've met who doesn't think there are things we could do better. So we're looking at how we can make our system better without losing the great things that are in it already.
Health Minister David Clark, thank you very much for joining us on Morning Report.
Thanks, Corin.